Hi, and welcome to this section of the training course. My name's Rachel Humphreys, and I'm an Environmental Health Officer here at Luton Council. Next slide, please. Thank you. So I'm just going to start by giving a bit of an introduction as to what is environmental health. And I've taken a lot of the information here from the Chartered Institute of Environmental Health. So environmental health encompasses all of the external factors that affect human health and well-being. So this ranges from the food that we eat, the air we breathe, the water we drink, to the wider impacts of human-made hazards on the world around us. And poor health often results from poor environments, and by helping improve the conditions in which we live and work, environmental health practitioners make a difference to the public's health and well-being. Environmental health practitioners can be found in every community, working to keep us safe and healthy and reduce health inequalities. So depending on their role, environmental health practitioners may be generalist, working across all areas of environmental health, or they may be specialists with particular areas of expertise. And the 5 main disciplines of environmental health are shown here on this slide. So the first one is food safety and integrity. So working in this discipline involves inspecting all businesses which prepare, store, distribute and import food. It also involves protecting customers with food allergies from harm. And the role involves carrying out inspections of food businesses and issuing food hygiene ratings. Also investigating complaints and providing education and carrying out the enforcement of food legislation. Next one is environmental protection. So environmental health practitioners working in this field are concerned with the air we breathe, the water we drink and the noise in the environment around us. And they work with planners to ensure that remediation work is carried out on contaminated land before building occurs on brownfield sites. The next area is health and safety. So responsibility for enforcing health and safety law, so health and safety in a workplace, is shared between the health and safety executive and local authority environmental health. And this depends on the activity that's undertaken at the workplace, with environmental health being responsible for shops, warehouses, fitness clubs, tattooists and body piercing, amongst others. So the work involves carrying out inspections, promotional work and investigations of complaints, accidents and work-related death. Housing. So this involves the inspection of private rented housing, including houses in multiple occupation, HMOs, to look for hazards such as overcrowding, damp and mould and lack of amenities. And then public health, which is work to tackle hazards or threats such as disease outbreaks. So the main focus of today's presentation is to explain how we're involved with the investigation of infectious diseases, working with the UK Health Security Agency. So when a Luton resident is diagnosed with a notifiable infectious disease, which is food or waterborne or a threat to public health, then the health protection team at UKHSA will notify us and they'll provide guidance on the required action. And these infectious diseases are categorised by the UKHSA into low risk, low to medium risk and high risk. And these can be shown in the first 3 columns here on this slide. And each of these categories requires different action. And the public health action that's required is detailed in a reference guide, which was produced by PHE before they became UKHSA. And they produce this guidance with the Chartered Institute of Environmental Health and the Food Standards Agency. And it's titled Recommendations for the Public Health Management of Gastrointestinal Infections. And you can find this guide on the .gov website. So just to give a bit of information about these 3 categories. So low risk infectious diseases are generally not reported to us here at Luton Council and no investigations needed. So the type of infections that fall into this category are cases of Campylobacter, norovirus, Clostridium perfringens. However, this isn't an exhaustive list. And actually Campylobacter is the most common cause of food poisoning in the UK. Each year there are about 50,000 to 60,000 reported Campylobacter cases in England, but the actual number of infections is thought to be about 10 times this number. So even though it's the most common type of food poisoning, it falls into this low risk category and isn't usually investigated. And the reason for that is that cases are usually sporadic rather than being part of an outbreak. And person-to-person spread is uncommon, with most people also making a full recovery. So even though it's the most common, the public health risk is low from these infections. And whilst as a rule, low risk gastrointestinal infections are not reported, when they appear to be part of an outbreak or whether there's an unexplained exceedance in rates in a certain area, then we would be notified and we could be required to take action. In the low to medium risk, so this is those in the yellow column here, there are 4 infections that fit into this category. So there's a Salmonella, Shigella sonnei, Cryptosporidium and Giardia. And we're notified of these cases by email, and we receive an email giving us the case name and address and phone number, the date of birth and the causative agent. And then we're required to contact the case. And when we contact them, we'll complete a questionnaire to obtain further information. So we can do this over the phone, we can send them the questionnaire, or we can do it by a home visit. And the purpose of this questionnaire is twofold. So firstly, it's to identify whether the person is in a risk group and therefore has to take any particular precautions to prevent the spread of infection. And secondly, it's to identify whether we can determine the source of the infection, and then if so, whether there is any preventative work needed to prevent any further cases. And there's a different questionnaire depending on the causative agent. So for Cryptosporidium, we'll be looking back over the incubation period, which is 10 days prior to the onset of symptoms. For Salmonella, we'll be looking back over the 5 days prior to onset. We'd be considering the travel undertaken in that time, the food eaten, places visited, water exposure, contact with animals. And we'd also be collecting information on contacts of that person, so co-travellers or household contacts. Once we've completed the questionnaire, it's sent to UKHSA and they use the information to identify local and national outbreaks and trends in infectious diseases. So high risk infectious diseases, these are the ones in this orange column here. These are the ones with the greatest public health significance. So in here you've got E. coli STEC, so E. coli 0157, Listeria monocytogenes, typhoid. And notifications of these high risk infectious diseases are usually telephoned through to the team and they're a priority for action. So just to run through a few of these infections and explain the reasoning behind this. So E. coli 0157 is high risk because it can be transmitted person to person, it can be involved in outbreaks, and it can lead to kidney disease and kidney failure and even death. So if a case is in a high risk group, so say they're an under 5, they're a food handler or a carer, they'll need to stay away from school or work until 2 negative stool samples have been received, and they need to be submitted 24 hours apart. And the reason for this is that the bacteria can still be shed in the feces of an infected person weeks after they've recovered. So during that period, there is still a risk that they can transmit it on to other people. So in these cases, we'd be required to liaise with the patient or their family, deliver postal stool kits, and then follow up on results. Listeria monocytogenes comes under this category. Even though it's a rare infection, it has a high fatality rate, especially in the vulnerable, so the elderly, and also in pregnant women, it can lead to miscarriage or stillbirth. And then you'll see that there is a 4th column here. So these are reports of food poisoning that we get in addition to the formal notifications from UKHSA. So we often receive complaints from members of the public who have been ill with vomiting or diarrhea and believe that it's been caused by a food establishment. So these are usually at this stage not confirmed cases of infectious diseases. So each of these are assessed on a case-by-case basis. Usually our first advice is to request that the person contacts their GP to submit a stool sample so that we can identify the cause of the illness. So people often associate their illness with the last meal that they've eaten, and this isn't always the case. For example, Campylobacter, it has a typical onset time of 2 to 5 days after consuming the food that contains the bacteria. So we do need to look back further than just the last meal that they've eaten. We would then look at the details of the level of food hygiene in the premises that they're suspecting has caused the illness. So we'd look at the latest inspection report, the compliance level, and we'd see whether there have been any other reported illnesses associated with that premises to determine if a visit's needed. And we'd also be asking them questions about the food they ate and their symptoms and whether anyone else that they're in contact with has been ill with similar symptoms. And we'd use all that information to determine what response we'd make. So next slide, please. So to ensure that all these functions that I've just described are carried out, there are a number of pieces of legislation that officers in the team are authorised under, and these provide us with powers for the purpose of public health infection control. So we have the Public Health Control of Disease Act 1984, but then we also have these other 3 sets of regulations that were introduced in 2010. And often when we need to use these powers that are in these pieces of legislation, a rapid response is needed to prevent a public health situation. So we have a toolkit that we can use. And this was produced by the CIH along with Public Health England, which then became UCSA, and it provides algorithms or flowcharts for us to follow in certain situations, and it's got template notices. It's also got letters and guidance that can be applied in a variety of situations. So if we ever are in a situation where we receive a notification and we need to take urgent action, then we can go to this toolkit and take the required action, and all the information's there. So next slide, please. So I'm going to explain in a bit more detail these 2 pieces of legislation. So we have the Health Protection Local Authority Powers regulations and the Health Protection Part 2A Order regulations. So the first of these provides a number of different powers which we can use when we're dealing with the kind of investigations that I've just talked about. Often voluntary cooperation is successful. In fact, usually we get voluntary cooperation. If someone needs to stay away from school, then the parent will ensure that they stay away from school, and they understand the risk involved. But when this isn't successful, or if there is a disproportionate risk involved, then formal powers may be needed. So, for example, if a young child, and this is usually under 5s who don't have the same kind of personal hygiene skills and awareness, then if they've been confirmed as a case of E. coli, then we may need to serve a notice if the parent isn't cooperating. So under Regulation 2 of these regulations, we can serve a notice requiring them to stay away from school. We also could do this if they themselves were not known to be infected, but were a contact of a case, depending on what the infection was, and again with guidance from the UK HSA. There's also, along with a template notice, there's template covering letters to use, and also a letter to send to the head teacher of the school so that they're aware that the child has been formally excluded from school until they've usually received the certain number of required negative stool samples. And then there's a letter to withdraw the notice when we've received that confirmation. So under Regulation 3, we also have the power to require head teachers to provide details on children attending the school. So this can be used if there's a requirement to trace children who could have been infected or in contact with an infectious disease. Regulations 4 to 7 are to require disinfection or decontamination of things or premises. And then Regulation 8 provides a very useful power, and it's probably the most used in these regulations. So it can firstly be used to exclude a food handler from work, so requiring a food handler to stay away from work if they're either a contact or a case, depending on, again, the infection. But it's also quite a wide-ranging power, and it can be used for a general request for cooperation for health protection purposes. So again, there's template notices to use to exclude a food handler, and also to send to their workplace after we've got confirmation from them that we can contact their employer to notify them of their exclusion. So other situations where Regulation 8 powers could be used could be requests for cooperation from an infected person. And at Luton, we've used these powers before to request cooperation from a person infected with TB, to require them to cooperate with appointments and comply with treatment requirements. And there are provisions in the legislation to compensate a person when we take this action, but this will be decided on a case-by-case basis as to whether this can be used. And then the final thing really in these regulations is to restrict contact or access to dead bodies, or the relocation of dead bodies. And these powers can be used where the local authority is satisfied that a dead body is or may be infected or contaminated, and it could present a significant harm to human health. And then there's the Health Protection Part 2A orders. Sorry, can we just go back to the previous slide, please? Thank you. So under the Health Protection Part 2A orders, the local authority can apply to the Justice of the Peace, so apply in the Magistrates' Court for one of these orders if it considers it's necessary to deal with a threat to human health from infection or contamination that could present a significant harm. So a Part 2A order could be used if the provision of the local authority powers regulations are not complied with. However, there's no requirement to use the powers in the local authority powers regulations first. It could be that you go straight to requiring and applying for a Part 2A order if the situation is, if that's necessary for a situation. So a Part 2A order can be made in relation to a person, a thing, a dead body or human remains, or a premises, so it's quite wide-ranging. It can require a person to be kept in isolation or quarantine, abstain from working, or undergo medical examination. And it can be granted from the court for a maximum of 28 days. But if longer is needed, then a further order could be applied for. So when applying for one of these orders, evidence is required, and this would include witness statements from professionals, and these will be presented to the Justice of the Peace, who will determine whether an order is the right thing to be granted. And if a person fails to comply with a Part 2A order, then they could be prosecuted for that. So some examples of when Part 2A orders have been used is for TB cases, so similar to the situation I described when you would use a Regulation 8 notice for cooperation. If that's not successful, which it usually is, then we could apply for a Part 2A order. Another example, and probably the most common use of these notices, is for tattooists, where a Part 2A order is obtained in relation to a thing. So this can allow the removal of equipment in order to prevent blood-borne viruses. And these orders are very rarely used. So just to stress that we do normally get voluntary cooperation, and we don't normally have to go down the route of applying to the court for public health reasons. Okay, next slide, please. So I've just listed some of the key partners and agencies that we work with in the environmental health team. So the main one being UKHSA. So they will notify us of infectious diseases, and they would also direct us on the actions to take. The Food Standards Agency may be involved. They issue food alerts and food incidents, and they also issue recall notices if food is identified to be unsafe. So if food has been implicated in an outbreak, then we may be notified of that and have to take action. Also, if we identify that food could be part of an outbreak, then we would notify the Food Standards Agency. We also work with the UK HSA Food, Water and Environmental Microbiology. So they're the laboratory that we use if we needed to undertake food or environmental or water sampling that's part of an outbreak. We could work with the Health and Safety Executive, especially for investigations of cases of Legionnaire's disease, especially if they're in HSE enforced premises, and then other council departments as well. And just to talk briefly about outbreaks. So if we were dealing with an outbreak, there would be an outbreak management team, and it's likely that a number of people from these different agencies could be required to be part of that outbreak management team. And that brings me on then to the scenario for this section of the training. Next slide, please. So this scenario is just an example of something that could come into the environmental health mailbox, something that could be reported to us. Have a read of the scenario, and using the workbook, have a think about some actions that you could take. So this is an example where you've been reported that 2 children are suffering from food poisoning type symptoms, and they both attend the same school, and the parents believe that it's the school lunches that have caused the illness. So in a scenario like this, you need to be thinking about what the causes of the illness could be. It could be food related, but also it may not be food related. And then think about what could happen, because this could escalate into a bigger incident, or it could be that these are just the only 2 cases. Okay, we'll pause now for you to work through this scenario. Thank you.